audience. Hello, my name is Todd Phillips. I'm a student at Concord and I'm in the PTA program. So today I'm going to be talking about Parkinson's disease. So first off, what is Parkinson's disease? Well, it's progressive neurodegenerative disease. Now let's break that down. Progressive means it gets worse as time goes on. Neuro is your nerves, and degenerative means it's going away. So as time goes on, your nerves are going away. Parkinson's affects a specific type of neuron that makes dopamine, and those neurons are called dopamine neurons. These neurons are made in the substantia nigra, which is just above the spinal cord in your brain. I have an example right here. Now, Parkinson's also affects a couple other parts of the brain, but the substantia nigra is the main one that gets affected. And the reason it's important that that one does get infected is because it's the main producer of the dopamine neurons. And the dopamine neurons make the dopamine, which is a neurotransmitter that helps muscles move, or makes them contract. So what are some signs and symptoms that you might have Parkinson's? Well, there's the famous shakiness and tremors, which people like Michael J. Fox or Muhammad Ali had. This is most prevalent in the hands and fingers. So, for example, you aren't able to hold still, and it makes some daily life things like trying to drink water really hard because you can't hold still. There's also stiffness. This happens when somebody tries to move wrong, or they try to move and they end up getting caught. And this can cause stiffness or cogwheel rigidity, which is when you your joints are going like a cogwheel instead of a normal smooth joint. There's also slowness of movements. This is due to the fact that there aren't as many dopamine neurons as there were before, so it just makes your movements more slow. And then there's also loss of balance, but this is one of the last things that shows up. So you usually see this in people with Parkinson's that have had it for a while. So a patient with Parkinson's may not show all three of these at once, or even all of them at all, but because it's a progressive disorder, eventually, towards the end, you'll see that they've at least had all four at one point. The first three together form a symptom called Parkinsonism, which is a disorder caused by a number of things, but Parkinson's is one of the major ones. And Parkinsonism can lead to other cognitive disabilities like depression, memory loss, and trouble concentrating. So what causes Parkinson's disease? Well, as of right now, nobody really knows what causes it. There are a couple theories out there, but there's nothing really of substance to hold it up. So most patients with Parkinson's disease don't have a previous family or any history of Parkinson's. So it's kind of a mystery on why 15% have it. Well, what they found out is that the 15% of families who do have it is a mutation in their genes that cause it. So if your family has that mutation, there is a high chance that you will get Parkinson's. It's not if you have that mutation you will get it, there's a high chance. So what are some risk factors? Well, obviously there's a gene mutation that I just talked about, but that's very rare. It's about 15% of Parkinson's cases. There's overexposure to pesticides, so when you're spraying for bugs or anything like that, make sure you're wearing a mask. And then there's also overexposure to chemicals, which when you inhale those chemicals, it can mess with the chemicals in your body, in your brain, which can cause other disorders other than Parkinson's. There's an increase in age, which is probably the most common one. As you grow older, around the age of 60, you have the highest risk of developing Parkinson's, and then from then on, with each passing year. So with each passing year, the chance of getting Parkinson's increases. And then there's a history of concussion, which I spelled wrong. But if you were younger, say you played football a lot as a kid, but you smashed your head a lot, or you just had a bunch of head injuries as a kid. As you grow older, that can lead to a higher risk of getting Parkinson's. So treatments. There's a lot of medication out there that puts the dopamine into your system again because you don't have those dopamine neurons to make more dopamine. So it helps you regain your muscle movements. But if some people have it too bad to where the medication doesn't work. So there's a couple surgeries out there that help you regain some motor function by taking out parts that are causing you to have that, muscle rigidity or muscle spasms or anything like that, to help kind of smooth it out. So these are my references. Are there any questions?
I know Parkinson's can be caused by other diseases. Are there symptoms of Parkinson's different when it is caused by Parkinson's disease rather than a different disease?
So you're talking about Parkinsonism, right?
Yes.
Okay. So with Parkinsonism is caused by a number of others, but those are called secondary Parkinsonism because they're not as common as being by Parkinson's. So if Parkinsonism is caused by Parkinson's, it's called by primary Parkinsonism. And no, there's not too many variations on it. Because of the different diseases, they're going to have the symptoms that you would have with that disease, but also with the memory loss and the loss of concentration. Those are the same symptoms you would get out of all of those.
Is Parkinson's more common in men or women?
Parkinson's is actually pretty even. It's not too picky, but we do see a slight increase in Parkinson's in men. We don't really know why. It could have something to do with genes, but there's just a slight in more men than women. So.
Thank you.